Good day. I am Alain Dave de Rosario from BSN1 and 15. Now I will be going to demonstrate on how to assess the skull and face, the eye structures and visual acuity, ears and hearing, nose and sinuses, mouth and oropharynx, and lastly the neck. So the basic concept on assessing the skull and face is an inspection and palpation of the skull and face, and also measuring the skull circumference, in which the presence of indentation and changes of facial shape may indicate disorder or a certain condition. Ano po? Assessing the eye structures and visual acuity is an examination of the eye that includes the external eye structure, visual perception, ocular movement, and visual fields. Assessment of vision provides important information about client's ability to interact with the environment and perform activities of daily living. Then, assessing the ears and hearing is an examination of the ear and structure and determination of the client's hearing acuity, which consists of direct inspection and palpation of the ear and techniques to assess auditory acuity and sound conduction. Assessing the nose and sinuses is an inspection and palpation of the external nose structure and sinuses, and inspection of patency of the nasal cavities. Then, assessing the mouth and oropharynx is an inspection of the structures associated with eating and taste, which is composed of the lips, oral mucosa, tongue, floor of the mouth, teeth, gums, hard and soft pulpate, uvula, salivary glands, tonsillar pilaries, and tonsils. Assessing the neck is an examination of the neck muscles, lymph nodes, trachea, thyroid glands, carotid arteries, and jugular veins. So its objective is to check for any deviations of the skull and face, eye structures and visual acuity, ears and hearing, nose and sinuses, mouth and oropharynx, and neck. To acquire information and accurate nursing history of the eyes and vision, ears and hearing, nasal or oral and neck of the client, and also to be able to formulate nursing diagnosis, collaborative problem, and referral. The preparation is to introduce first yourself and verify the client's identity. Explain to the client what you are going to do and why it is necessary, and how the client can cooperate. Also to perform hand hygiene and observe appropriate infection control procedures. So I will use, to perform the hand hygiene, I will use the ethyl alcohol in order to prevent acquiring contamination. And lastly, to provide for client privacy. The first procedure is to inquire if the client has any history of the following: lumps or bumps, itching, scaling or dandruff, loss of consciousness, dizziness, seizures, headache, facial pain, or injury. If so, ascertain the following: when and how any lumps occurred, length of time any other problem existed, any known cause of any problem, then associated symptoms, treatment, and recurrences. Now let us inspect the skull for size, shape, and symmetry. But before that, you should wear gloves to prevent acquiring infection. But since I have no gloves, assuming that I have used my gloves, so after, measure the size of the head using the tape measure. But also, since I have no tape measure, I will assume that I have my tape measure. So, assuming that we're done to inspect the size of the skull of the patient, then we'll proceed. We're going to palpate the skull for any presence of nodule masses or depression. And take note that only use your fingertips and gently perform it using rotating motion. And start from the front palpate downward to the midline and each side of the head. So rotating motion to palpate the skull of the patient. Then, we need also to inspect for the features on the face and inspect eyes for the presence of edema or hollowness. Take note also for the facial movement of the client. So as the client elevate the eyebrow, can you elevate the eyebrow? Then from lower eyebrow, close eyes tightly, puff cheek, and smile and show teeth. Smile and show your teeth. Yes. So, after documenting, we will now proceed in assessing the external structure of the eye. First is you need to inspect the eyebrow for the distribution of hair alignment and skin quality and movement. So inspect the eyebrow, then the hair alignment, then assess also for the evenness and distribution of the eyelashes, eyelid surface, and its characteristic, position, and ability of the client to blink and the frequency of blink. Can you blink, sir? And inspect the lower leg of the client's eyes when it's closed. Close your eyes, sir. Now we will then proceed in inspecting for the lacrimal gland and the sac. Observe for edema between the lower leg of the nose and observe for evidence of increased steering. Then use only the tip of your finger and palpate inside to the orbital rim near the inner canthus. So palpate it gently and note for the evidence of increased steering. Next, after, we would now assess for the corneal clarity and texture. Ask the patient to look straight ahead. Look straight ahead. Hold the pen light. Hold the pen light at an oblique angle to the eye and move the light slowly across the corneal surface. Making sure that the light should not directly be in the patient to prevent any form of catpalgia. Note also of the possible findings that you may encounter during assessing the corneal for clarity, the tearing and the redness, and if the patient will complain of extreme sensitivity to light. Now, we're going to be performing the corneal sensitivity test to determine the function of the fifth cranial nerve. Now, inspect the pupils for color shape and symmetry of size. Assess each pupil's direct and consensual reaction to light in a partially darkened room. So ask the client to look straight ahead again, then using a pen light and approaching from the side, shine a light on the pupil. So observe the response. Okay now. Observe the response, then shine the light on the pupil again and observe the response of the other pupil. Assess each pupil's reaction to accommodation. Then hold an object about 10 cm from the client's nose. So ask the client to look first at the top of the object and then at the distant object behind the pen light. Alternate the gaze between the near and far objects, then observe the pupil response. So I will put an object, then alternate the gaze between the near and far object. Then next, move the pen light or pencil toward the client's nose. The pupils should converge. To record normal assessment of the pupils, use the abbreviation P parallel. So now let's proceed on assessing the peripheral visual fields. Have the client sit directly facing you at a distance of 60 to 90 centimeters. Then ask the client to cover right eye with the card and look directly at your nose. So can you hold this, sir? And cover your eye. Then cover, close your eye directly opposite the client's covered eye and look directly at the client's nose. Hold an object in your fingers, then extend your arms and move the object into the visual field from various points in the periphery. Ask the client to tell you when the moving object is first spotted. Then next, the other side. To test the temporal field, can you take that off? To test the temporal field of the left eye, extend and move your right arm in from the client's right periphery. To test the upward field of the left eye, extend and move the right arm down from the upward periphery. And to test the downward field of the left eye, extend and move the right arm up from the lower periphery. And lastly, to test the nasal field of the left eye, extend and move your left arm in from the periphery. Repeat the above steps from the right eye. Then let's proceed to assess the extraocular muscle test. So assess 6 ocular movement to determine eye alignment and coordination. So we'll stand directly in front of the client and hold the pen light at a comfortable distance such as 30 cm in front of the client's eyes. Going to stand at the center at the front of the client. Then ask the client to hold the head in a fixed position facing you and follow the movement of the pen light with the eyes only. So move the pen light in a slow, orderly manner through the 6 cordial fields of gaze. Then stop the movement of the pen light periodically so that nystagmus can be detected. Then we were going to assess for the location of light reflex by shining a pen light on the pupil in corneal surface. Then have the client fixate on a near or far object, cover one eye and observe for movement in the uncovered eye. So sir, can you cover the one eye? With your hand, using your hand. Yes. Then let's then have the near or far object. Then the other side, sir. Then let's move on. To assess near vision by providing an etiquette lighting and asking the client to read from magazine or newspaper. So assuming that the client done to read from a magazine or newspaper, then let's move on to assess near vision by providing etiquette lighting and asking the client to read from a magazine or newspaper. Assess distance vision by asking the client to wear corrective lenses unless they are used for reading only. So now let's proceed on assessing the ears and hearing of the patient. So the preparation is to assemble equipment, so which is the otoscope. So since I have no otoscope, I assume that this pen is my otoscope with several sizes or ear specula. Then now we will now proceed in assessing the ears and the hearing. First is prepare all the materials here, which is the otoscope with several sizes, or your ear specula that should be fitted. Now we're going to explain the procedure and inquire for any health history for hearing, losing medication, if there are complaints of bringing use the ears, any difficulty, and hearing the use of corrective hearing devices. and position the client in a comfortable or seated position. So, and now inspect for the position. Note the level with disappear aspect of the oracles that is attached to the head with relation to the eyes of the client. We're going to palpate after inspecting the articles. For the strike texture, elasticity, and areas of tenderness by gently pulling the oracles upward in a downward manner. Then palpate. Then gently pulling the oracle on. And backward fold the pinna forward. Then it should recoil. Then we're going to push the term loose. And then apply a pressure to the mastoid process. Next, the external ear and canal and tympanic membrane. Before inspecting for the ear and canal and tympanic membrane, do wear gloves, but since I have no gloves, we gonna assume that I have my gloves. Now inspecting the client's head should be away and from the examiner. The examiner should hold the otoscope either right side up with fingers between the otoscope and insert it gently to the ear canal by avoiding pressure of the spare column and side of the ear canal. Now, we proceed to assess the gross hearing acuity test. The clients respond to in normal tone. If the client has difficulty in hearing a normal voice, proceed with the watch tick test. So here's my watch. Out of the client's side, place a ticking watch to 2 to 3 centimeter or 1 to 2 inches from the unconcluded ear. Then ask what the client hear, then repeat with the other ear. Close the other side, then 1 to 2 inches away. Then the other side. Then now we're done on gross hearing acuity test.